Chinedu is my name. I want to share this message with you to help you in case if somebody that is very close to you, it could be a family member, it could be your child. Let's say for instance, your loved ones who doesn't have any history of mental illness, but all of a sudden you find out that the person is beginning to exhibit a signs that will convince you that this person might be going through some type of mental breakdown or having some symptoms of mental illness. It could be the person is becoming very aggressive or becoming delusional, seeing things that are not there, talking to themselves, being confused, being paranoid, not eating food or eating too much or sleeping too much, something that is not of that person's behavior. At that point you just found the person with that such behavior. As a person, most people, I'm not saying everybody, most people, the first thing that will come in their mind is to take the person to mental hospital. But this video is to encourage you, to support you, to tell you the right thing to do. It's not a wrong idea, because we act on our instinct and sometimes we make a mistake. But that mistake could lead to something more serious. So when you find out, I would suggest you take the person to a regular hospital. Here is the reason. Most mental hospital does not have all the necessary procedures to examine and undergo all kinds of tests to find out exactly what is wrong with that patient. The first thing they will do when you take them to a mental hospital is to administer a psych medicine, which apparently the person has no history of mental illness. Maybe the person is going through confusion, or maybe is going through depression. Depression can cause by any kind of thing in that person's life. It could be that the person is going through some type of challenge, some type of problem, some type of chemical imbalance. So mental hospital will never give the person some medical test because they are there to treat mental patients, right? So when you take the person to a mental hospital, the first thing they have to do is to check the person's behavior. Based on that person's behavior, they will now administer a psych medicine to treat the person as a psych patient, which could has a side effect on the person, because with somebody that has a history of mental illness must have undergo some type of test to ascertain if that medicine will have side effect on the patient or not. So, but when you take the person to the psych hospital, they'll start giving psych medicine, which could cause more problem to your loved ones. And you're not going to blame them because they want to save the situation. They want to stop the person that's trying to harm himself or maybe destroy themselves or harm other people. So, but when you take the person to regular hospital, in a regular hospital, they have mental health, specialists. They have psych doctors. They have medical doctors. They have neuroscience doctors. They have all kinds of doctors that will look into that person's case and make the right decision. I've seen somebody went to a mental hospital and it was given a psych medicine. The side effect becomes so severe that the patient couldn't even close her eyes for 7 days. What did they do? They end up sending the patient to a regular hospital. And thank God, the person's life was saved, and they fixed the problem. And, so the best thing you have to do when you find your loved ones in that kind of situation, or even old people, which is very common, an old person that has UTI is possibly going to have some type of confusion, or even people that has, or low sodium or high sodium. Anything can cause problem in somebody's body to make that person, exhibit some type of mental behavior. So going to mental hospital is not the first step. The first step should be to go to regular hospital. Then let the doctors in a medical hospital or regular hospital do what they're supposed to do. Then if they make an assessment and confirm that the person is going through mental problem, or maybe whatever that has put that person in that situation has made the person become psychotic, or the person has become a potential psych patient, then they will make the reference, send the person to a mental hospital. Then they will run a test to know the medicine that will not have side effect on the person. Then the treatment will now start. Okay? Thank you for watching this video. Hope this video will impact your life and save your loved ones. Bye-bye.